At Festival Hall, the House of Stoush, late yesterday afternoon, 4,500, I guess, defiant nurses voted unanimously to continue their industrial action, closing hospital beds, cancelling surgery, effectively defying the orders from the industrial umpire, Fair Work Australia. The consequences of that unanimous vote is that the nurses are now in breach of the law. Individual nurses who continue to take industrial action of that nature could be fined up to $6,600 each. They could face up to 1 year's jail, every one of them. They will have their pay docked. So says the spokesman. The government says breaking the law is irresponsible. And as we speak, the nurses are about to head into the federal court to challenge this Fair Work order to cease industrial action. Tomorrow they're going to march on Parliament demanding that the Premier step in and fix up this dispute, which is now dragging. On the line is the woman in the middle of it all from the Australian Nursing Federation, the Victorian Branch Secretary, Lisa Fitzpatrick. Lisa, great to talk to you before you head into court.
Thanks very much, Steve.
Lisa, why are nurses now continuing their industrial action in breach of the law?
In essence, Steve, nurses have no choice. The government seek continually to force us into a full bench arbitration. That arbitration, which is same as what the Qantas have gone through now, that arbitration is not able to determine to include our nurse-patient ratios or our skill mix clause that we currently have that puts a requirement on employers to make sure that registered and enrolled nurses are making up those ratios. So if nurses proceed to a full arbitration, those matters will be lost automatically because they cannot be contained. The full bench cannot determine those matters because of a re-AEU decision in the High Court back in the 90s. So what the government is seeking to do is to ask nurses to trade off their nurse-patient ratios in order to receive a 3.5% wage increase.
But the government is simply asking you to comply with the law at the moment, and Fair Work Australia are asking you to comply with the law. Your course forward is to breach the law.
Well, as I said, we have no choice in relation to where we go in this matter. If we do nothing, then nurse-patient ratios go. We did offer a proposal that was put to the government and ourselves by Justice Bolton of Fair Work Australia around having a consent arbitration on all matters that were not resolved between the parties. Now, a consent arbitration could have allowed nurse-patient ratios to be included. However, the government refused that offer. They simply want to proceed to that full arbitration because they know that patient ratios cannot be contained or cannot be determined by the full bench of Fair Work Australia. So, we have no choice but to fight on. Otherwise, our nurse-patient ratios go, and that means nurses will leave the system. We'll be back to the 90s. We'll have permanently closed beds every day in our public health system. We have to make sure, Steve, that our public health system can accommodate the increasing demand of extra patients. Every year, 500,000 additional patients are accessing our public health system. We need to make sure that we keep pace with trying to meet that demand. We have hundreds of new graduates coming into the system next year who will not be able to get jobs in graduate programs because there is a lack of funding for those programs. So we are really at a critical point in relation to workforce. All of the research demonstrates that, the main thing that impacts on workforce into the future is retention of staff. We have to do all that we can to make sure that we not only retain our existing nursing and midwifery expert workforce, but that we also make room and have sufficient funds for additional nurses and midwives to be employed into the future.
Lisa, even agreeing with every sentiment that you've just expressed, if you can't get the government to the table within the law, within the current process, haven't you got Buckley's if you're breaking the law and defying an order of Fair Work Australia?
Well, Steve, we are in conciliation. We start again this morning at 9 a.m. We've been in conciliation since the 9th of November. But what we need is the government to change its strategy and to tell its representatives that are at that table about how to, to actually settle the dispute rather than pressing on trying to force that full arbitration. So, it's time for the government to abandon its secret plan that it signed off on the 5th of May, which it was exposed, in the Sunday Age, and it's time to be serious about negotiating an outcome. The government cannot just keep relying on fining nurses or docking nurses' pay. They actually need to come to the table and help resolve the dispute.
Lisa, all of the community has incredible goodwill for the exceptional job that nurses do, and therefore, I think, for any claim you might reasonably make. But in defying the orders of Fair Work Australia, in adopting this particular path, are you not at very real risk of dissipating the genuine community goodwill toward nurses?
Steve, the nurses are doing this for the community as well. They could easily if they accepted that full arbitration, they would get a wage increase that was very significant and bring them into line with their interstate counterparts. But this dispute isn't just about a wage, it's about our nurse-patient ratios. And the nurse-patient ratios are what protect the community. So I'm very hopeful that the community will attend our rally starting at the Bourke Street Mall at 12:30 on this Thursday, walking to Parliament with us, calling on the Premier to actually intervene, to demonstrate leadership and to make sure that the dispute gets resolved.
Any chance that any of your nurses who are now defying the Fair Work Act could be jailed? I mean, the maximum penalty is 12 months jail. The maximum financial penalty, $6,600 fine. I mean, that's a lot of money for your nurses. Any chance they could be fined? Do you see that could actually be imposed?
Well, Steve, these threats were made. The legislation was quite similar in 2007. Our nurses were docked for 9 days in the last dispute that we had around our enterprise agreement, and every day that they were docked, they continued to stay at work. They could have been fined last time up to the $6,000. They weren't. They could have been taken to the federal court in relation to their action and had, penalties imposed against them. That didn't happen. It's not going to resolve the dispute by picking on and bullying nurses into submission. Nurses want to see an outcome. They want things to resume to normal, but we do have to be mindful. Every day in the last 12 months, we've had some 6,600 patients whose elective surgery has been cancelled within 48 hours over the last 12 months. There has not been one whimper from the government in relation to that issue. We have hospitals that have got policies about how to cancel elective surgery on the same day. So we're disappointed that the Minister is concerned about cancellations when it comes to the nurses' action, but cancellations as a result of no nurses' action, we don't hear anything from the government at all.
There seems to be a massive gulf between what you're asking for, the 18.5% pay rise over the 3 years, and the 2.5% with productivity gains and requirements that are on the table. This seems to be a massive gulf, and even the action that you're taking, precipitous as it is, how is that going to edge anywhere towards some sort of acceptable compromise for either party?
I think it's important to understand that we have had no wages offer from the government since we started negotiations. So we have no information in relation to a wages offer in relation to our enterprise agreement. The nurses are prepared to accept a reasonable wage increase. Asking nurses to be more productive really is insulting for our members. As I said, 500,000 patients get treated in our hospitals every year. There aren't any more beds, and that means that those 500,000 patients mean that all of our patients are in hospital for less time. They're being discharged quicker. Their acuity is greater. It's more demand on the work that our nurses are doing. Even the government's own document admitted that they were unable to provide and find productivity measures within a system that is already so strapped for cash.
Lisa, at yesterday's meeting of 4,000 nurses, big meeting, you sang Tom Petty's I Won't Back Down. Who picked the song?
A number of our members picked the songs that they wanted to have at that meeting. There was a number that were played, but I do believe that the nurses are very resolute. They do appreciate what is at stake here for them and for the community regarding their nurse-patient ratios. They won't give them up. They want to maintain and improve them so that we can make sure that we are continuing to care for our patients safely into the future.
And if the Federal Court doesn't grant a stay on the orders of Fair Work Australia, are you still going to continue this industrial action in defiance of those orders?
We'll wait and see the outcome of the Federal Court today. We're not relying on legal tactics. What we're relying on is negotiated outcomes.
Lisa Fitzpatrick, great to talk to you.
Thank you very much, Steve.
Lisa Fitzpatrick from the Australian Nursing Federation, Victorian Branch Secretary. Steve Vizard, Melbourne Talk Radio, MTR 1377.